So issues with regard to histamine are a really big deal these days, and there's a lot that's been written about that. And I want to address those and how they just might be related to adrenal issues. I'm Dr. Andrew Neville, and I specialize in treating adrenal fatigue, and the vast majority of my patients do have issues with histamine. So what is histamine, right? So histamine is a molecule, it's a peptide that's in the body. It is made by some immune cells active in the body. So these immune cells called mast cells basically will release histamine, and histamine brings in fluid. It causes vasodilation and redness and swelling. Hives, right, are kind of one of your typical histamine types of reactions. Interestingly, histamine is also a neurotransmitter in the brain. It's actually a neurotransmitter of wakefulness, which is why your typical over-the-counter antihistamines, like a diphenhydramine, Benadryl kind of a thing, come with a warning saying, be careful operating large machinery when you're on this, because if you take an antihistamine, you're less wakeful, right? And it can affect driving and things like that. People will take it at night as well to blunt that histamine because it's a neurotransmitter of wakefulness, right? When somebody has chronic stress over time enough to overwhelm their genetic predisposition to adrenal issues, the body starts to get stuck in fight or flight, right? When that happens, those stress hormones hit the immune system and cause a very predictable shift in the immune system. That shift shifts us toward creating antibodies and allergies to things. And not all allergy is kind of associated with histamine, but a lot of it is, right? So histamine reactions are incredibly common in my patients. While my patients have environmental allergies, they have food allergies, they can have problems with eczema or hives or the contact dermatitis type stuff. And the evidence of histamine in the brain, right? Too much wakefulness is not that apparent as like a big rash or something. It comes in the form of anxiety, or the brain can't slow down, or insomnia, things like that. So I see histamine issues all the time, right? If it's severe enough, you can get it diagnosed as mast cell activation syndrome or mast cell activation disease. Has different names. And people think, okay, you have all these symptoms, histamine issues, you have histamine symptoms, that's the cause of your problem. What I kind of drive my patients and other doctors crazy with is I always ask why. Well, so why do I have all these histamine issues? Like, what's the big deal? The main controller of that allergic tendency, mast cells, histamine, is going to be that stress physiology. So the number one thing we have to do when people have histamine issues is we've got to start working at the core, at this underlying level of shifting this physiology, treating that adrenal fatigue, right, holistically, getting people out of fight or flight, stopping the messages that are going to the immune system, which is basically just cranking it up and overexciting it. That said, there are some things we should do when histamine goes crazy, because it can get in this kind of feed-forward cycle where the histamine stimulates the stress response stimulates the histamine, and it goes crazy. So there's some natural things that we can do. I do a food allergy or food sensitivity test on almost all of my patients, try to decrease that insult at least, which triggers histamine. So we'll take a look at that. But there are a couple of natural antihistamines that I use pretty regularly in my practice. Vitamin C is one. Plain old ascorbic acid. It's an amazing histamine scavenger. So it doesn't necessarily prevent histamine, but it scavenges it up and kind of eats it up. And we are all chronically deficient in vitamin C. So as much vitamin C basically as your bowels will tolerate. It's incredibly safe. The others, there's some bioflavonoids in nature that are natural antihistamines. One of the best ones and one of my favorites is quercetin. Quercetin with the Q. It's yellow. It gives some fruits and veggies their yellow coloring, onions and garlic, notably, things like that. But you can take quercetin like over the counter, and it acts as a mast cell stabilizer, so they're not as jittery, ready to explode and release a bunch of histamine. So I use quercetin pretty regularly in my patients that have this allergic tendency, that tendency towards histamine. Remove the insult, deal with some of the histamine issues, but all the while, Focus on treating this underlying cause. When you focus on that, I mean, I have seen allergies and histamine-related issues just gradually go away over the course of time. Okay, so treat superficially, but focus on the cause as well. Good luck.